And first, we begin with some important news coming in. Top sources at the ICMR have told CNN News 18 that the ICMR will resume study that it had to abandon to gauge community transmission here. 75 districts have been picked by ICMR to study community transmission. ICMR will also be studying community transmission using ELISA kits. Separately, the center has also tweaked the discharge from hospital criteria for COVID patients. Here, only severe cases will be tested before they discharge. Let's go across to my colleague Sneha Modani. She has been tracking the health ministry for us. Sneha, let's look at each of those news points one by one. First, let's talk about the ICMR deciding to revise community, whether community transmission is happening by carrying out a study in 75 districts here. What exactly has led the ICMR to rethink its original statement of no community transmission?
Yes, in fact, the ICMR is going to resume the study, I would say, because these 75 districts had been shortlisted by the ICMR for study just a couple of weeks ago. Rapid testing was to be used here, serological test kits, if you recall, were to be used here, and that study had to be abandoned midway because the efficacy of serological test kits had come under the scanner after China made test kits, in fact, failed the test. In fact, they were found to be faulty. Now, what's happening is that there has to be some sort of a study to understand community transmission and what can then the ICMR do. Lab-based tests are considered more accurate, much more accurate than the serological test. And this is something that the WHO has also, in fact, said that these are more accurate, these are more desirable. ELISA kits are now going to be used in all likelihood. These are lab-based tests, and in all likelihood, this is going to be announced by the ICMR formally, maybe by Monday. We can expect other types of lab-based, tests also being carried out. ELISA is going to be one of them. There have been at least 3 firms that have been validated by the ICMR, is what I know. 2 from China, 1 from Germany is what I've been given to understand. So there are 3 at least ELISA test kits that have got the validation. That's that. Now, what are these ELISA, testing? What's ELISA testing? These are actually enzyme-linked immunosorbent assay testing.
Okay.
Basically, this comes at a time when we require how to have a graded sort of an exit from the lockdown. This has the same function as the rapid testing, in the sense that they also detect antibodies. So this is the same function technically. It's just a different form of a test.
All right, Sneha, let's also look at the other important news point that's just coming out from these flashes that you've sent us. The tweaking of the discharge of hospital criteria for COVID patients here. Can you explain what the new criteria is and why that has to be affected?
Yes, that's another important development that we've been pointing out. All this while, remember, the government of India had in fact said that all cases are in hospital. Now we know that all cases are not recuperating in a hospital. 85% of the patients have mild symptoms, is what we've been given to understand. Is there an expectation that there could be an increase in cases maybe next week, and to avoid overburdening of the healthcare system, not just, looking at the shortage of healthcare facilities maybe, but also avoiding overwhelming of the healthcare staff? Is the government then tweaking this policy? The evident answer really is yes, because what the government is saying right now is this. There is going to be, in fact, a different sort of a criteria. RT-PCR tests are going to be done only on patients with severe infection who are going to be discharged after clinical recovery, complete recovery of those patients having severe infection. Patients tested negative once the RT-PCR test is done, meaning the test is going to be done on these patients having severe infection, and this is going to be verified by a clearance in the RT-PCR test, and then there is going to be discharge of the patient. However, in patients with very mild or pre-symptomatic patients, or patients who have moderate infection like fever and other things, maybe even breathlessness, they are going to be discharged after resolution of the clinical symptoms and ability to maintain oxygen saturation for 3 days in a row. And for them, no RT-PCR testing is going to be required. Well, the government of India would be in a better position to explain the ICMR and the government of India as to why they've tweaked it and why do they feel that patients with moderate infection and who have had a history of breathlessness or, a problem of saturation of oxygen, why are they being discharged without RT-PCR test? Now, let me tell you, in cases of pre-symptomatic or people with infection but not displaying many symptoms or not displaying symptoms at all, the RT-PCR tests actually don't even pick these symptoms up. So that makes sense. But what about patients with moderate infection? Because if they have the symptoms, the RT-PCR, test picks these symptoms up. So why is this being avoided? I think the government would be in a good position.
Well, as you pointed out, Sneha, there could be one explanation as to why the government has found it necessary to tweak these symptoms. And that is ineffective, the quote that came out from the health secretary yesterday, that we have to learn to live with the virus. Sneha, thanks a lot for joining us with that update. Well, yes, indeed, we have to live with the virus. That is the big message from the center, even as the number of cases in India crossed 56,000. In about a few minutes from now, we'll get a fresh update today about the latest number of cases across the country. Now, as of now, there are nearly 36,000 active cases and over 1,800 deaths here. The recovery rate continues to remain at 28.3%, which means that 1 in every 3 COVID patients is being cured. Now, reacting to the AIIMS director's prediction that India is yet to see the peak between June and July, the center has assured that it can be prevented if all guidelines are implemented properly. But Mumbai and Delhi continue to remain the biggest concerns for the government as the number of cases continue to rise.
हमारी रिकवरी परसेंटेज देखें तो वह अभी 29.36% हो चुकी है।
सर, कल एम्स के डायरेक्टर का एक बयान आया कि जो कोरोना का पीक है वो जून जुलाई तक जाएगा।
तो जैसे कि एम्स के डायरेक्टर साहब ने कहा है और इससे पहले भी हम लोगों ने कई बार चर्चा की है कि अगर हम रिक्वायर्ड डूज एंड डोंट्स का पालन करेंगे, लेकिन जिस भी समय पर अगर हम कोई भी प्रिकॉशंस का रिक्वायर्ड प्रोसेसेस का पालन नहीं करते हैं तो केसेस में स्पाइक आने की संभावना रहती है। हमें एक बहुत बड़ा चैलेंज हमारे सामने है जो हमें समझना होगा कि वी हैव टू ऑल्सो लर्न टू लिव विद द वायरस। एंड व्हेन वी आर टॉकिंग अबाउट लर्निंग टू लिव विद द वायरस, तो बहुत जरूरी है कि जो वायरस से बचने से संबंधित जो गाइडलाइंस हैं हम उसको कम्युनिटी में एज ए बिहेवियर चेंज के रूप में लाएं।
Meanwhile, the center has dispatched a team of top AIIMS doctors, including AIIMS Director Randeep Guleria, to Gujarat in order to study the situation in the state, which has seen a massive spike in COVID-19 cases. In the last 24 hours, 380 new coronavirus cases have come forward, with 24 deaths being reported. 269 cases and 22 deaths have been reported in Ahmedabad alone. The latest figures take the total number of cases in Ahmedabad to 5,260, with the death toll hitting 343. The total number of cases in Gujarat is 7,403, with the death toll being at 449 as we speak. Let's go across to my colleague Janak Dave, who is joining us at this point from Gujarat. Janak, ये काफ़ी चिंता का विषय है जिस तरीके से अहमदाबाद में केसेस बढ़ते जा रहे हैं। जहां तक हमें पता है कल से शहर में काफ़ी एक सीवियर लॉकडाउन लगाया गया है जिसमें एकदम एसेंशियल छोड़कर और कुछ भी चीज़ लाने के लिए बाहर निकलने की अनुमति नहीं दी गई है। क्या इससे सरकार को आशा है कि कोविड-19 के केसेस कम हो जाएंगे स्टेट में?
देखिए, सरकार अपनी ओर से पूरी संभावित कोशिश कर रही है, क्योंकि जो आंकड़ा बढ़ता जा रहा है वो बेहद चिंताजनक और उसमें भी खासतौर पर अगर आप देखें अहमदाबाद, पूरे गुजरात के जो जितने मामले आते हैं उसमें 80% मामले केवल अहमदाबाद के होते हैं। कल भी जो 24 मौतें हुई उसमें 22 मौतें अहमदाबाद में हो रही है। तो मरीज बढ़ने का एक चिंता का विषय तो है, लेकिन सबसे बड़ा जो चिंता का कंसर्न है वो जो मौत हो रही है वो मौतें हैं। पिछले एक हफ्ते से 20 से ज्यादा, हर रोज 20 से ज्यादा मौतें केवल अहमदाबाद से हो रही है। ये सबसे बड़ी चिंता का विषय है और इसके चलते ही गुजरात के मुख्यमंत्री ने गृह मंत्री अमित शाह से बात करते, कुछ बड़े डॉक्टर्स को यहाँ बुलाकर उनसे सलाह मशवरा मार्गदर्शन देने के लिए कहा गया था। तो ऐसे में एम्स के डायरेक्टर के अलावा बाकी 9 लोगों की टीम, तो कुल मिला के कहें कि दिल्ली से जो बड़े नामांकित डॉक्टर हैं एम्स के डायरेक्टर की अगुवाई में, ऐसे 9 डॉक्टर्स भी आज यहाँ पर आ रहे हैं जो सिविल अस्पताल और एसवीपी जो बड़े कोविड सेंटर हैं उन दोनों सेंटरों की मुलाकात लेंगे। डॉक्टर्स जो हैं वहाँ के उनको बताएंगे कि किस तरीके से क्या कुछ हो सकता है। इससे पहले भी न कि केवल दिल्ली बल्कि बॉम्बे से भी जो देश के नामी डॉक्टर्स है, पल्मोनोलॉजिस्ट से लेके बाकी कार्डियोलॉजिस्ट जो है, तो यहाँ पर जब संक्रमण होता है, जब वेंटिलेटर में जाता है तो बड़े कार्डियोलॉजिस्ट की जरूरत पड़ती है। तो ऐसे में कार्डियोलॉजी के हिसाब से किस तरीके से होना चाहिए, तो ऐसे तमाम जो पहलू हैं वो सरकार करने की कोशिश कर रहे हैं। और आज जिस एम्स के डायरेक्टर आएंगे अपनी टीम के साथ, तो देखना होगा कि क्या वो सलाह मशवरा करते हैं, किस तरीके से आगे बढ़ा जाए। कुछ नए आइडियाज के साथ वो सरकार वो तमाम चीजें करने के लिए तैयार है। ऐसे में पूरा का पूरा जो स्टाफ होगा, डीन है, डॉक्टर्स हैं, पैरामेडिकल स्टाफ है, उन सभी को मार्गदर्शन दिया जाएगा इस तरीके का। तो कल देर रात को ही एम्स की जो पूरी टीम है जो दिल्ली से आई है, वो देर रात को ही 10 बजे के आसपास विशेष विमान से अहमदाबाद आ चुकी है। और आज अहमदाबाद सिविल हॉस्पिटल और अहमदाबाद का जो सरदार वल्लभ भाई पटेल हॉस्पिटल है एसवीपी, तो वो दोनों अस्पतालों में जाकर दौरा करेगी।
Janak, thank you so much for joining us with those updates. From Gujarat, which is the second most affected state, let's shift our focus to the most affected state, which is Maharashtra, where in Mumbai, the Maharashtra Chief Minister Uddhav Thackeray has shunted out Praveen Pardeshi from the Mumbai Civic Commissioner's post, as the city counted over 12,000 cases and 437 deaths from the novel coronavirus. Additional Chief Secretary of the Urban Development Department, Iqbal Singh Chahal, has now replaced Pardeshi to the Civic Commissioner's post, while Pardeshi has been transferred to take over Chahal's old post. Now, Thackeray has also moved out Mumbai's additional Municipal Commissioner, Abbas Saheb Jarrad, replacing him with former Thane Municipal Commissioner Sanjeev Jaiswal. Now, the Maharashtra continues to be the worst affected state, with Mumbai contributing to the bulk of the COVID-19 cases in the state. Now, 20% of India's cases are from Mumbai alone. So, what's really happening in the maximum city? We take a look at Mumbai's biggest problem areas.
60% of Mumbai's COVID-19 deaths are in its slums. Its biggest slum is also its biggest problem, Dharavi. The writing was on the wall ever since the first case was detected in Dharavi on the 2nd of April. It took just 30 days to zoom to 600 cases, and that curve is showing no signs of flattening. And it's not just Dharavi. Mumbai's slum belt from Mankhurd to Shivaji Nagar, as well as the slums of Kurla, Mulund and Worli, are hotspots too. The reasons are obvious. Social distancing is impossible. Hygiene has always been a challenge. The other challenge, Mumbai's crowded jails. They were always on the high-risk list. Despite early orders to decongest and isolate jails, 100-odd people, both prisoners and staff at Arthur Road Jail now, have tested positive. Police personnel elsewhere in Mumbai too are falling prey to COVID-19. More than 30 cops have tested positive at JJ Marg police station alone. The other frontline personnel at risk, healthcare workers. Wokhad Hospital was sealed with more than 80 staffers testing positive so far. In Jaslok Hospital, the figure is close to 60. Nanavati Hospital, Bhatia Hospital have also recorded cases. A fresh worry, the wholesale vegetable markets. The APMC market has been shut down after nearly 100 workers here tested positive. This is the market which is the biggest supplier of vegetables and food grain to Mumbai and its adjoining areas. Slums, jails, police, hospitals, markets. That's where maximum city needs maximum intervention.
And let's now get you an update from Karnataka, where standalone clubs, boarding hotels and bars can sell their existing stock of alcohol but only at MRPs and only for takeaway from 9 a.m. to 7 p.m. This is a new order that's come in from today till the 17th of May, which is when the current phase of lockdown 3.0 comes to an end. Let's go across to my colleague Stacey Pereira, who's joining us with more details. Stacey, what more can you add to that?
Well, in fact, Karnataka has always been among those few states that has wanted to open up the economy and try to, have that revenue come in for the state. And since this Monday, when liquor shops were open, there are over 3,000 liquor stores across the state that have bought in, over 500 crores in the past 5 days, one can say, to the excise department. And there was a demand that came from the hoteliers also, that there was a lot of existing stock that was piling up, and with an expiry date of sorts that come to beer at least, that is something that they want to get rid of, and which is why the government has now given permission to CL4, CL7 and CL9. These are your pubs, these are lodges that have a permit to serve alcohol, as well as eateries that have permit to serve alcohol. They are going to be allowed to sell it, but only for takeaway and only between 9 to 7 p.m. So those are the guidelines that have been given in. So from today, it's not like you will be able to go and venture out to these places. You'll have to just take away, and you're going to get to serve alcohol at MRP days.
All right, Stacey, thanks a lot for joining us. Of course, that means there is some good news, essentially happy hours, if I could say so, for people in Bengaluru. Speaking, of course, of happy hours, let's now look at what Delhi is doing. The Delhi government has launched an e-token portal for liquor sale in a bid to prevent chaos and ensure social distancing. But how effective is the system? My colleague Runjun Sharma gets you this report.
आप सभी लोग सोशल डिस्टेंसिंग जरूर मेंटेन करें, कम से कम इतनी दूरी जरूर हो। आप देख रहे हैं 1 मीटर की दूरी कम से कम जरूर हो।
Jostling crowds, winding queues, even a lathi charge. Scenes seen outside most liquor stores as shops reopened with all social distancing rules ignored. The government was forced to order their closure.
After 40 odd days, when liquor shops finally opened, there was so much crowds and chaos that in East Delhi at least, all the liquor shops were ordered to close down.
लेकिन ये 2 गज की दूरी तो दिखाई नहीं दे रही है आपने। सर एक्चुअली लाइन आती है तो आगे रहते हैं ना।
Even the imposition of a 70% corona fee did not deter die-hard customers.
Despite a 70% corona special tax that is imposed on liquor in the capital by Kejriwal government, the queues outside liquor shops are massive.
अच्छा करा टैक्स बढ़ा दिया, गवर्नमेंट को पैसे की जरूरत है और तभी बढ़ा दिया, ब्लैक में भी लेके पी रहे थे लोग। सही किया, इसे तो भीड़ भड़का याद है। 2000 रुपए की बोतलें ले रहे हैं, उससे तो अच्छा है, ये सरकार के खाते में तो जा रहे हैं कम से कम पैसे।
The chaos has forced the Delhi government to start an e-token system for customers. Log on to www.qtoken.in, select an outlet and book a time slot for buying liquor. The token number with a QR code is sent to the customer's phone. Just 50 tokens will be issued per hour to keep the rush in check. But it's still not smooth sailing.
Even though the Kejriwal government has come up with the solution of distributing e-coupons to people who want to buy alcohol, customers are facing problems logging into the portal. There seems to be so much traffic that the site has crashed. In New Delhi, I'm Runjun Sharma.
And let's quickly get you a list of all the other stories across the country related to the novel coronavirus. Starting, of course, with good news for students. The CBSE will be holding pending board exams from July 1st to July 15th. This includes pending Class 12 and Class 10 exams as well from the right-hit areas of Northeast Delhi. The result of the Class 12 board exams will be announced before the JEE Advanced releases its merit list. The Supreme Court has asked states to consider home delivery of alcohol while responding to a PIL. The Apex Court has directed states to control the rush outside liquor stores, which is leading to violation of social distancing norms despite stringent lockdown measures. The Odisha government has increased the quarantine period from 14 days to 21 days in the state, so those returning from other states will remain in institutional quarantine for 21 days, and the remaining 7 days will be in home quarantine as well. Besides, prohibitory orders under Section 144 will be imposed in areas surrounding the quarantine centres. And apart from Maharashtra and Delhi, another state which is posing a big challenge is Tamil Nadu, where 600 positive cases were reported in the past 24 hours. The worst hit city in the state is Chennai, which has reported 400 new cases in the last 24 hours. The Madras High Court has ordered for an immediate shutdown of all liquor stores in the state. Instead, it has asked the government to consider home delivery of liquor. And now let's get to the latest on the world's largest repatriation exercise, which is the Vande Bharat mission. It is progressing smoothly. Yesterday, flights from Dhaka, Dubai, Singapore, Bahrain and Riyadh brought back Indian nationals to Srinagar, Chennai, Kochi and Kozhikode. Today, more Air India flights from Dhaka, Kuala Lumpur, Kuwait, London and San Francisco carrying stranded Indians nationals are expected to arrive. Meanwhile, the INS Jalashwa, which you see on the right of your screens, is also on its way to India from the Maldivian capital of Male with 698 Indian nationals on board. Let's go across to my colleagues who are getting us the latest here. We have Sagar Gupta who is joining us live from New Delhi and Purnima Murli who is joining us from Chennai as well. Sagar, coming to you first. Yesterday there was one flight which touched down in the Indira Gandhi International Airport here, but we saw a glimpse of the list of the precautions and the steps that were in place to ensure these passengers were taken straight from the airport to the quarantine centres. Today there are a lot more flights which are landing in Delhi. What is the arrangements that have been made so far?
Well, flight from Dhaka is also coming to Delhi again. What I am going to confirm to you is, of course, about more than 60,000 stranded people are being arranged by the Indian government under Vande Mataram mission that they are pouring. Yesterday, like you said, a flight touched upon Delhi International Airport. What we saw were the visuals of how arrangements were made. So, for example, one thing was clear just yesterday, that these arrangements, so the transportation will be covered by and will be arranged and coordinated by the state governments. So not necessarily that people coming to Delhi from the world will be quarantined in Delhi itself. They might be home quarantined or they would be institutionally quarantined in their respective hometowns or states. So that was clear just yesterday. The second is, of course, about the protocols, which was, of course, about the thermal screening, and there would be a registry also maintained of all the passengers who would be deboarding. And so there is going to be several questions to them as well about their contact details, about their addresses, so that the government, Indian government, does have a record as to what is the health condition of that particular passenger who is deboarding, and their contact details if the government wants to contact them further. The third is, of course, the symptom checker. So there's going to be several questions on their health conditions as well. Do they have past experiences and past health conditions of, for example, tuberculosis or breathing problems or asthma? So these are the questions that they will be put to, not just in Delhi, but in Srinagar, in other states, in Chennai, in Kozhikode. So these are the places also where the flights are going to be coming, and there are about more than 60,000 people who will be taken back to India.
But then again, are the states prepared to take this additional load? Let's get an update from Chennai. Purnima, Tamil Nadu is going through one of the worst periods in its fight against coronavirus. There have been about 400 to 500 cases coming up daily. In a situation like this, how prepared really is the state to handle an extra influx of people coming in from some of the most sensitively hit and some of the most sensitive countries across the world?
Well, the protocol was followed. 359 passengers boarded and landed early in the morning today, and they were given two options. One was, of course, to choose a quarantine center by the government. This time around, a private college was chosen for those who wanted to stay for free for 14 days, because they will be put up in quarantine centers. The other option was for those stranded people can even stay in a list of hotels that was chosen by the state government, and they have to pay for the hotel. So these were the two options given to those who had arrived in Chennai. Of course, even before they were put up in quarantine centers, they were in fact all the swab tests were taken and their temperatures were checked and sanitizers were kept at different gates and different entries to ensure that they kept using the sanitizer every 20 minutes. So that was followed and it was a long procedure. Private buses were allowed and social distancing, they say, was followed throughout from the time they started till the time they from the time they boarded till the time they reached Chennai, and now they will be put up in these quarantine centers for 14 days. Since, as you know, there are so many positive cases, the state government is now looking at schools and colleges and turning them into isolation wards as well. So the quarantine centers right now are a list of schools and colleges because the numbers are increasing and they're now looking at these institutions as quarantine centers. So some of them are put up in quarantine centers and some of them have chosen to stay in hotels for the next 14 days.
All right, Purnima and Sagar, thank you so much for getting us those updates. So we'll also be going across to my colleagues Zeva and Shreya and Maha as well as we get in more updates from flights coming in from various parts of the world today. But for now, it's time for a short break. More news and updates continue on the other side. Stay with us.